Excellency. I hope you can hear me at the back. I'm going to try to shout. I have a little problem where I think I'm shouting, and I was like, Chino, you talk so quiet. So I'll really try my best to shout and project my voice. And at this point, because we have taken up so much of your time, and on behalf of the Zambian Network, I sincerely apologize. There were logistics delays that were out of our control. We're now going to stand for prayers. After the prayers, we are then going to invite Her Excellency to come and say a few words to us. If you'd like to stand for prayers. Heavenly Father, we come before you to thank you for bringing us all here together. But most importantly, I thank you for Mother Zambia. I thank you for all that you're doing in the land of Zambia and in our midst. Father, I thank you for everybody here present. I thank you for each speaker, Father God. I pray that each word that will be spoken will land on good soil. And on that soil, it will germinate to something more powerful. That they will have a beginning to their story. They will say, on the 27th of September, I attended an event that changed my life. Father, I want to thank you so much that you do not only just love Zambia, but you also love the people of Zambia. And with that alone, I just pray for the success of this event. And as we come to the conclusion down the line, that everybody return to their various destinations safely. In the name of our Lord Jesus Christ, I pray. Amen. Amen.
Good afternoon, everybody.
Good afternoon, ma'am.
Am I audible enough?
Near your mouth.
You can't hear me.
Near the mouth. Yes.
I thought my voice was as loud as Chile's. Okay, good afternoon, everybody. Okay, I am here to do a very simple task, to give you opening remarks that should have been given by Her Excellency, the High Commissioner, but she's unable to be here due to other commitments. As you heard, my name is Lubu Chiwenumalo. I am the Deputy Head of Mission here. Good afternoon, everybody. On behalf of Her Excellency, the High Commissioner of the Republic of Zambia to the United Kingdom, it is my pleasure to welcome you all to Zambia House. The High Commissioner really wanted to be with you today, but unfortunately, her schedule could not allow it. She sends her warm greetings and best wishes for the success of this event. Today's theme, Health, Wealth, and Ubuntu, Pioneering the Future of Entrepreneurs in Healthcare, could not be more timely. It captures the spirit of what brings us together, the drive to innovate in healthcare, to support economic growth, and keep up Ubuntu. Our belief in community and shared humility, all at the center of it all. This gathering is important because it shows the strength, the Zambian diaspora, and the power of collaboration across borders. The work and ideas shared here today can create opportunities not only in the UK, but also in Zambia, where healthcare solutions, partnerships, and investments have a lasting impact. As a mission, we are proud to support platforms that connect the Zambians, friends of Zambia, and partners who are passionate about making a difference. So on behalf of the High Commission, I wish you an afternoon full of meaningful connections, inspiring conversations, and practical steps towards shaping a healthier and more prosperous future together. I'd like to thank you for your kind attention. Maybe before I take my seat again, just to echo, I think a lot of us don't know our national anthem. We should learn it. It's our pride. All the three verses, we should know them. It's our pride. It's not supposed to be beamed here because we learned it at school. So please, it's homework. Thank you very much.
Thank you so much, Your Excellency, for those wonderful words. And yes, to echo on the spirit of Ubuntu, it's people from the Ngoni tribe of Zambia, and it means humanity and community and interconnectedness. So those words and business don't always align, but here you have people who've gone ahead and they've done certain things, pick up the nuggets, join with them, build a stronger community, take what you can get from them and run with it. But most importantly, the connectedness is also follow them, follow what their progression, support them in ways that you can and are able to. Okay, for those who have the program, there's been just a slight change, but before I proceed, just for safety precautions, the exit will be the way you came, out of the door onto your right-hand side, and I believe it's towards the park. So just don't take anything with you, just get up and run, but do not go home because we need to account for you. Toilets are one flight of stairs. Again, then you turn left, I believe, and take another flight of stairs for the gentlemen and one more flight of stairs for the ladies. We have refreshments at the back. It is quite hot, so if you're feeling thirsty, please, I know you're in a room of doctors and healthcare professions, but also if you feel a little bit thirsty and dry, please help us have some water. Just going back to the program, there has been a slight change, so we just tweaked it up a little bit. So we're going to have the first person who's going to come up is Dr. Mnanji Matele. She's a digital health interrogation in healthcare and evolving in the world. And so I think she works for the tele-doctors in Zambia. Please let me welcome Mr. Matele, Dr. Matele.
Thank you so much, Master of Programs. I would like to acknowledge the presence of our Deputy High Commissioner and all protocols observed, and simply say good afternoon, everyone. Just a small correction, my name is Dr. Namunji Matale, thank you. Just a brief bio on who I am. I'm a medical doctor, proudly trained in Zambia. I am also an obesity and weight management specialist. I sit on the executive for the Medical Women's Association of Zambia as the Ethics and Advocacy Chairperson. And I am here to present to you a Zambian-owned and Zambian-grown brand known as TeleDoctor. Just waiting on our IT. Wonderful. So I'm here to present to you on digital health integration, transforming care in an evolving world. I'll give you a brief problem statement, what the solution is, who we are as TeleDoctor, as well as a small investment ask. Next slide, please. So right now in Zambia, we are facing a dual crisis of having a very, for lack of a better word, absurd doctor-to-patient ratio. WHO recommends that for every one doctor, they should treat 1,000 patients. But that's not the case in our beloved country. For every one doctor, they are treating 12,000 patients. Yes, so you can imagine that's why you see so many long waiting queues, people having unmet healthcare needs. And then on the other end of the continuum, we have a problem of unemployed doctors, a high number of unemployed doctors. We're proud to say that Zambia has 10 medical schools producing doctors every year, in addition to those who study abroad. But unfortunately, because of certain systemic bottlenecks, we're not able to have everyone absorbed by the government. So there's a high rate of unemployment, and we can't really, blame anyone. It's just the population is growing. There's just a lot going on. So, next slide, please. The solution is telemedicine. Sure. Are we good? Okay, thank you. The solution is telemedicine with TeleDoctor. Next slide, please. So you might wonder, okay, what is a TeleDoctor or who is TeleDoctor? TeleDoctor is a Zambian organization and brand that basically connects people to health providers through technology and technological advancements. You might wonder, okay, why did you guys start, or where is all of this coming from? If there's anything that COVID-19 taught us, it's that we need to evolve with the times. It showed us the weaknesses in the health system and how best we can move forward and actually get people the care they need without even being in the same room as them. And that is how TeleDoctor Zambia was born. So we have a mobile app, I'll share a QR code at some point, which connects people to health providers nearest to them. We have a 24-hour online service desk, and basically it's very convenient and even saves on transportation costs. Next slide. So just a product overview. It starts with a simple virtual consultation. The same way you have a Zoom meeting is the same way you have a chat with your GP or your doctor via an online platform. And then in the event that you need to get a prescription, we actually have an e-pharmacy where you receive your online prescription and then you can get to the nearest pharmacy for your prescription. And of course, if you're required to have an in-person service, maybe you need to be examined further, or you need to go to the lab, or even want to have a portable device put on you to monitor you from your home, all of that is available with TeleDoctor. Next slide, please. So we have something very special. We have the Diaspora Health Service. As you may know, you're here in the UK and maybe you have relatives back home who might have fallen ill and you want to be able to support them to get them connected to a healthcare provider. So we have our Diaspora Health Service, which is transparent and trustworthy. As you may know, sometimes you can be sending back home money for an ill patient and the money's going elsewhere and you don't know where it's going and you're wondering what's going on and the patient is getting worse. But with a service like this, there's some transparency to it because we also give you feedback as the person who is supporting the care of the patient. Next slide, please. So that little diagram, which may seem complicated, but is not, is just our ecosystem. Basically, what it's explaining is how it all works. You start with a simple download of the app. You have a virtual consultation. And then if you're required to come into a clinic or a hospital, we direct you to the nearest one for further care. In the event that you don't, we direct you to our e-pharmacy if you need to get an e-prescription, and then you proceed to collect your drugs at the nearest location. Next slide, please. So if you could take a moment to scan so that you can download the app and even just see what it's like, I would really appreciate that. I'll give you 20 seconds before, okay, maybe 20 seconds is too long, but I'll give you a few seconds before I proceed to the next slide. I appreciate the spirit of Ubuntu that has been shown by everyone scanning. Thank you. We can proceed to the next slide, please. So some of the milestones that we've achieved. Madam Vice High Commissioner, or Deputy High Commissioner, you'd be proud to know that TeleDoctor is a third-time recipient of the Tech Trends Award in Zambia. For 3 years running, we've been winning the Tech Trend Awards. We recently, thank you. So we're a third-time recipient of the Tech Trends Awards. We've had the TeleDoctor Zambia show, which is a radio and television show in partnership with Radio Phoenix and Diamond TV that airs every Tuesday and every Wednesday in partnership with those two organizations, which is basically a platform to share about common health conditions and make it more palatable to your everyday person who doesn't understand medical terms. And you'd be proud to know that we recently expanded our borders. We're no longer just in Zambia. We are now in Malawi and South Africa, and we will be venturing into Nigeria very soon. And also, we launched the first ever, or rather inaugural, entrepreneur medical endeavor, where we as TeleDoctor called stakeholders like government, people in the NGO space, investors, the pharmaceutical companies, and medical schools to sit down to see how we could strategize on the issue of unemployed doctors. Next slide, please. So I present to you a few challenges and their corresponding opportunities. So some of the challenges that we have on the ground are limited healthcare access, long waiting times, and the issue of high unemployment amongst doctors. Now, we would like to propose solutions of us being the solution as TeleDoctor by expanding our reach and enabling us through financial investments to expand our reach with technology, AI, and the digital world, as well as investing in young doctors through what we recently launched as the Young Doctors Program. Next slide, please. So that's just a brief presentation of the investment opportunity. We have three that are showcased there: the wellness centers, the Young Doctors Fellowship Program, and medical devices. Next slide, please. So when it comes to the wellness centers, Right now, our facilities are based in Lusaka and on the Copper Belt, but these are mostly clinics and mini hospitals. But we have a plan that's slowly rolling in to build 3 multi-facility wellness centers in prime locations, namely Lusaka, on the Copper Belt, and in Livingston. I was very happy to hear one of our colleagues talk about medical tourism, because we want to venture into medical tourism. People don't just want to come to the hospital because they're sick. They just want a place where they can do Pilates and go to the gym and have a pool, or, you know, we have a lot of med spas these days. People are into aesthetic medicine, and there's so much of that expanding in Zambia right now. And we want to tap into that market as well. So that presents as an investment opportunity. The next slide, please. Sorry about that. The Young Doctors Fellowship Program is something that is actually a charitable investment opportunity. Right now, because the system is unable to absorb everyone when they graduate from medical school. So Teledoctor thought it best to see how we can choose offer a service to unemployed doctors and give them a 1-year mentorship and fellowship program in entrepreneurial skills to just make them ready for society, because it's not fair for someone to go to school for 7-8 years and then sit at home and not have anything. And then for those who even volunteer in hospitals, this will be kind of like an incentive to say, at least you get the entrepreneurial skill. And if someone offers to sponsor a doctor for about £5,000 for the whole program for an entire year, they're able to get the 10 modules for the entrepreneurship program. They're able to earn a small stipend in addition to that as well. Next slide, please. Teledoctor has been one of the partnership organizations with several device companies that want to expand their space into the Zambian market. For example, right now we have a device that we use on patients to have 24-hour heart monitoring. I'll give you an example. If you have a relative who has a heart attack, for example, and they're adamant on not staying in hospital once they've been stabilized, we actually have a device that we can strap them to from home and monitor their cardiac or heart activity from home, and we're able to see what's going on with them. And in the event of an emergency, we have a team on standby to either pick them up via ambulance or receive them if they choose to come to the facility on their own. Next slide, please. So this investment opportunity is not just for the wonderful people in this room. If you know people out there who are willing to invest in wellness centers, who are willing to invest or sponsor a doctor, who are willing to even just team up to say, how best can we introduce IT into the medical world? This is the time for that. We are a pre-existing brand. We are no longer in the startup category. We are growing, we're expanding our borders, and it would be nice to have fellow Zambian investors step into the market with us. We want to leverage on medical tourism. It will be a good opportunity for you to invest not just in health, but in other people's health. And it's a win-win because technology is always the in thing. Next slide, please. I would like to acknowledge this wonderful team that's on the screen. I would like to make mention of our CEO, Professor Wilbrod Mutale, who would have loved to be here, but he had other engagements. Our visionary director, Ms. Ann Tora, and our clinical director and my personal mentor, Dr. Tello. Next slide, please. So if you would like to express any form of interest, whether you think you would like to invest or sponsor or even just partner up in any way, feel free to scan the QR code on the screen. And thank you so much. That brings the presentation to an end. Thank you so much for your attention.
Yeah, in a few years' time, Zambian healthcare, watch out. I really do see it. Innovation, all that. And I hear about the cancer centers there as well, which is great. So well done, well done. So I will not delay as we have delayed long enough. So the next speaker, she has gone across the world with activities across Africa, Southeast Asia, countries Ethiopia, Nigeria, and regional organizations to improve public health and global health security. She's an epidemiologist.
Not dermatologist.
I knew that was going to happen at some point. Epidemiologist, that's right. She's a global health security and health system strengthening expert, mentor, and a STEM advocate. She is currently serving with the health technical specialist of the UK and healthcare security agencies. Now that is a wonderful CV. Please, ladies and gentlemen, can you please help me welcome Lukeki Kanindama.
Good afternoon, Madam Deputy High Commissioner. Good afternoon, everyone. It's a pleasure to be here. All protocols observed. So yes, the pleasure to be here for this event as we think about and discuss health, wealth, and Ubuntu. And we've already heard from our previous presentation an example of innovation in this healthcare space. So the theme, the three pillars of the theme are not only timeless, but they're very relevant to how we reimagine or think about healthcare in Zambia, the UK, and the interconnected world that we live in. So all the views I will be sharing are from my own personal views, nothing to do with my organization. So to take some step back, my journey in healthcare began many years ago from childhood, where I grew up seeing firsthand the devastating effects of the HIV/AIDS pandemic, as well as seeing vivid images of the famine across East Africa. So it sparked an early conviction in me to be like, that's where I want to work. I want to do that. And that spark grew into a career and further interest in infectious diseases, spanning research, academia, the private sector, and now working in public health. In the UK, I've worked in the epidemiology and surveillance fields. For those who don't know what an epidemiologist is, some people like to think of it as a disease detective. You try and identify where the sources of diseases are, infectious diseases, and map them, figure out trends, analyze them, that kind of thing. And so my career has also included infectious disease outbreaks such as COVID-19 and the Mpox response as well. Across Africa, I have worked in Zambia, Nigeria, Ethiopia, to name a few, and in Southeast Asia more recently, where I've supported capacity building, which includes training healthcare professionals, supporting capacity building in terms of development of strategies, championing healthcare networks to strengthen systems so that they're more resilient to be able to prevent, detect, and respond to health threats, namely infectious diseases. This is guided by the One Health approach, which is something that I champion quite a bit, that connects human, animal, and environmental health to improve health security. As we are all living in a post-COVID world, we know that not one area, one sector is responsible for health security. They're all interconnected, and the better that they work together, the more resilient the response will be. So through my varied experiences, one thing has remained very clear to me, that health systems are only as strong as the people within them. The people within them, the people who engage with them, the people who critique them, but they're only as strong as the people. To create resilience, sustainable care or healthcare systems, we must invest in the people who deliver it and in the technology and infrastructure that enable them to work effectively. This includes investing in the healthcare workers, communities, entrepreneurs, innovators who dare to transform the system. When we think of health today, we must also think beyond hospitals and clinics. As I said, COVID-19, the persistent threat of infectious diseases, recent environmental events such as floods and droughts show how interconnected we truly are and how broad health can be. During the UK's COVID-19 response and the Mpox outbreak, I witnessed the power of rapid collaboration where scientists, clinicians, data analysts, community leaders were working side by side to save lives. Across Africa, countries were predicted early in the pandemic that they were going to suffer the highest mortality rates, and they were forced to be very strategic with limited resources. This urgency drove innovation in telemedicine, which we've had an example of today, contact tracing, and supply chain management. And overall, thankfully, the mortality rates were not as bad as previously predicted. There are also other examples of, in Zambia, of this innovation. I read recently that Zambia launched Africa's first solar-powered clinic through the Gavi initiative, which is a $28 million health facility solar electrification program, so that by 2026, 1,277 facilities across Zambia, across Ethiopia, Pakistan, and Uganda will have reliable energy for vaccine refrigeration, maternity care, and critical equipment, improving the health services for approximately 1.3 million people. And then there are other local innovations that we hear about, that I heard about while researching, such as a digital platform to support the improvement of maternal health, because we know maternal mortality rates can be quite high. Initiatives looking at digitizing medical supply chains to reach remote clinics, and using remote diagnostics and AI, this world of AI, to bring up affordable point-of-care testing to underserved areas. Each of these examples reminds us that innovation is not a luxury, it's a public health necessity, and entrepreneurs are key drivers. But innovation cannot thrive on passion alone. We need sustainable wealth generation, not only financial capital, but intellectual and social capital. Earlier this year, I'm sure we've all seen the ramifications of the shutdown of USAID, how it pulled out from across the world, but particularly in Africa. This had impacts on HIV programs, maternal health programs, etc. And this showed a very hard lesson that lives on the ground suffer when there's an interruption to services. It also highlighted the urgent need to build and invest and support resilient healthcare systems led by government, businesses, communities, so that the country's health does not depend on decisions being made far away. So wealth could mean attracting investment to ideas that save lives, like the one we've just seen, building enterprises that create jobs and keep talent at home, designing business models that serve patients while sustaining growth. This is why events like today are so powerful, because we're bringing together brilliant minds who have taken those steps to do something, to change the environment around them, not just here in the UK, but also in Zambia, to highlight their work and spark those collaborations to bridge and further strengthen the relationships between the two countries. And then lastly, when we think about Ubuntu, wealth and innovation must be anchored in something deeper. This is where Ubuntu, the I am because we are, becomes our compass. Ubuntu teaches us that success is collective. It's not one person. Sorry, I've messed up my notes. Okay, sorry, 1 second, technical. I relied on our old school paper and pen, and I just need to scroll to the last bit of my speech. Okay. So, Ubuntu teaches us that success is collective. My personal work focuses on technical partnerships that are country-led and not donor-driven. Our One Health approach embodies Ubuntu by bringing animal, human, and environmental sectors together. I have witnessed Ubuntu not just in that, but in how some of our activities where we delivered a cross-border simulation exercise across countries in Southern Africa, so Zambia, Zimbabwe, Namibia, Angola, bringing health officials from these different countries together to solve common problems to serve the communities in these regions. And we see Ubuntu in various ways, from the Zambian entrepreneur who builds the healthcare app and is sharing it here, from the UK-based physicians that mentor and encourage development with Zambian medical staff back home, of those students. We see it in the dedication of the nurses, community health workers, and caregivers whose names we may never know or who may never appear in the headlines, but whose work sustains the foundation of healthcare, both here and back home. And it's not always something big. It's how do you show up in your community? What ideas do you have? I personally am not an entrepreneur yet, but for me it's important to champion healthcare, whether it's from going to schools, talking about STEM, or mentoring young people in universities, helping them see someone that they can relate to, be the example that you want to see. Because Ubuntu reminds us that we cannot go far alone. We all have to rely on each other. So today I just want us, as we're listening to the various discussions and presentations, to just think that this is our moment to co-create health solutions that generate wealth and embody Ubuntu. I think the various speakers will give their presentations of their work, their initiatives, and we can see how we can support. We might not be in the forefront, but we can have a part to play in building the future that we want to see. So what will each of us build together? Collectively, together is how we make change. Thank you.
God did not design you. Exactly. We're not supposed to survive, we're supposed to thrive. And can I get the next slide, please? So this is a quote by a very famous psychiatrist, Dr. Henry Maudsley. You might know the hospital named after him. And he says, "The tears that we do not cry make other organs weep." Can anyone think what that actually means? Just shout it out. Exactly. If you don't cry your tears, you hold it inside. So if you think of your body, if there's any dis-ease in your body, it manifests as disease in your body, basically. Dis-ease in the mind manifests as disease in the body. I always have this saying that when you look around, you see the walking wounded, because there are so many people in this world who are, I suppose, the result of their trauma that they've experienced. The trauma can be a small thing, but it can also be a very big thing. Now, for myself, when I was 11, I was molested by a family friend, and I'm no longer the walking wounded. And I think that my story is not unique. There are so many other people out there, probably even in this room, who've experienced certain things, whether it may be violence, some sort of abuse or something. But the thing is, most of the time, when you're functioning, you're kind of functioning subpar, you are programmed to behave a certain way. And for me, it manifested as people-pleasing and just kind of doing what people said. And so there's something called trauma response. Can I have the next slide, please? And so there come in a set of, there's a few. So you may have heard of fight or flight, which is the one that everyone hears, but there's a couple of others as well. So there's freeze and fawn. So the fighting, obviously, you get into defense mode, you're gonna fight. But here's the thing, when you've been through some kind of trauma, you're going to respond in the same way, so you're getting triggered. So something might have happened years and years and years ago, but you'll get triggered years later. There was one lady I worked with, 84 years old, and she was still getting triggered by something that her father did when she was 16. And then where you have the flight, which is to run away. So some people, that's what they do. Or you have the freeze, where you just stop and you don't do anything at all. What do I do? And then the fawn, which is the people-pleasing. But it manifests in so many different ways for so many different people. And it's really sad, because when I see pain in somebody, it's like I can't unsee it. I'll start talking to somebody, and within the first meeting already, I found out, oh, okay, this is why. This is what happened. And I think God actually gave me this, I call it the truth serum, because it doesn't matter who the person is. Somehow I put them at ease. They start telling me things they've never told anybody in their life. It's quite an interesting experience. So I want to do a little bit of an exercise with you, because I want you to kind of just have that understanding of the connection between your mind, between your body. So I'm going to invite you to Sit up comfortably in your seats. Just get comfortable. Make sure your feet are parallel. And just use the backrest of your chair as well. If you're standing, okay, no one's standing, we're fine. Okay, and then what I invite you to do is I invite you to close your eyes as well. Don't worry, keep an eye on your valuables, we're fine. Okay, and so what I want you to do is make sure your chin is parallel to the ground. And imagine you've got a string at the top of your head and it's stretching up towards the sky. I want you to just get really tall and comfortable. Relax your shoulders up and back in your seat. And then I want you to look straight ahead, but then I want you to drop your eyes so you look into the floor. And then I want you to close your eyes. Now that your eyes are closed, I just want you to take notice of the sensations. So just follow my instructions. First of all, I want you to notice the ground beneath your feet and how solid it is and supporting you. Then I want you to notice the chair underneath your bottom supporting you and the chair at your back supporting you. Notice the weight of your hands in your lap. Maybe you're holding something in your hands. Just notice that as well. And then I want you to notice the temperature of the air around you. And then you might feel a breeze. And then I want you to also just, you can hear my voice, so just pay attention to my voice, but you can hear other sounds in the room. There may be some shuffling, different things going on. And then I want you to take your awareness now to your nose and your breath. As you're breathing in, breathe into your nose. As you breathe out, notice the air coming out of your nose. Maybe you notice the difference in temperature as the air goes in, as the air comes out. Cool on the way in, warm on the way out. And as you breathe, when you breathe in, are you noticing where the air is going? Does it go into your chest? Or do you feel your belly expanding and it's filling up there? And then I want you to just, out of 10, notice your emotions. 10 being, I feel wonderful, I feel amazing. 2 being, not so great. Just register that in your mind. Then I want you to notice your body. Energy-wise, 10 being, I feel amazing, I can bounce up and down on a trampoline. 2 being, feeling a bit, I'm pushing through, it's not so easy. And just noticing the difference. And then taking that awareness again, back to your body, and noticing, are there any aches and pains anywhere in your body, starting from your feet to your head? Maybe in the hips, knees, shoulders. What do you notice? If it's sitting in the shoulders, maybe you've got too much work on your hands right now, so you're very, very busy, and you've got a lot, and you're feeling overwhelmed. I'm going to say a few words, and each time you hear the word, I want you to notice what happens inside your body as I say the word. Joy, happiness, laughter, kindness, fear, hate, anger, worry, sadness, pain, contentment, calmness, floating, faith, healing, happiness, joy, joy. Just take note of how your body felt. Maybe you noticed a change in your heart rate. Maybe it changed and wasn't so good when I said the negative words. Just register that. And when you're ready, I invite you to open your eyes once again. Is anyone willing to share how they felt during that exercise? Anyone?
Sure.
Okay, go for it.
Each word that you said took me to a place of where I was when I felt that whether it's anxiety or worry or pain. I was taken right back to that place.
Okay, so you notice the power of words. Your words matter. How you speak to your children matters. How you speak to your friends. How you speak to yourself on an everyday basis. If I came up to you in your face and said to you, oh, you're so this, that, and the other, you would turn around, you want to punch me, right? But guess what? When you say those words to yourself inside, in your heart, there's no one there to tell you off. So be mindful what you say with your words. I'm going to come back to that exercise. So, we are made up of spirit. You are a spirit living in a body with a soul. And your soul, you can translate that into the mind, basically. Your mind, you register, you process emotions and everything that's going on in your system. Your physical body is the most external part of you. Your spirit, the most internal part of you. But you need all three aligned and working together for you to function and operate effectively. You know, some people, they might go out, do loads of exercise, they lose the weight, but they haven't sorted out the internal things. You know, when it comes to the emotions, it's always a good idea to, you register the emotions because they give you that element of, okay, this is what's happening in my system. But what you don't do is act on those emotions. It's never a good idea to act on your emotions. For me, I always say, I ignore my emotions because if I start processing them, it's fine to process, but I don't allow myself to move and operate from a place of emotion. You want to operate from a place of faith and clarity and wisdom. So when we think about healthcare, we're all here looking at healthcare, Ubuntu. Health is wealth. You could be the richest person in the world, most wealthy person financially, but if you don't have your health, it is a problem. It's a problem. And, you know, I was loving what the teledoctors do. I'm actually going to have a chat with her later about the centers. But when you think about how the human body is made up, like I said, you're made up of 3 different parts. So, unfortunately, when you go to medical centers, generally, they focus on one or the other. You know, if you go to a psychiatrist, he's focusing on your head. Go to the doctor, here, take a pill. You know, and then, you know, if you think about someone's got a backache, they're like, oh my gosh, my back. It's like, okay, that's a problem. They give you a pill, they send you home. But the issue is that's not solving the problem. Why do you have a backache in the first place? Is your environment not correct? Do you have, you know, are you sitting wrongly? Do you have a bad posture? Are you not exercising enough? Or do you have weak abs? Do you not do enough exercise? It could be so many different things. And this is where we have to think together. When we're doing all the work that we're doing, all the planning, all the entrepreneurial healthcare, we have to think about looking at a person on a holistic level. There is space for doctors, there is space for, you know, psychologists, therapists, all of that. You have to work and look at somebody holistically. So when I speak to people, you know, I ask them, oh, how were you raised? What was your upbringing like? Where do you work? What do you do? I literally ask every single thing. So I want to know, what's your life? What's happened to you? You know, there's one lady I was speaking to. She came to me and she had a bad shoulder. She literally couldn't raise her, I think it was her left shoulder. She couldn't raise her elbow higher than this. And I said to her, what happened? She said, nothing. I didn't have an injury. It just started hurting one day. I was like, okay, that doesn't make sense. I was seeing her in December and she had the injury, I think in July time, so summer holidays. Okay, she had a son, school holidays. Okay, what happened during the school holidays? One, she was living abroad, she's away from her family, she doesn't have anyone, she's a single parent, so there's not really that much support for her. Okay, so what does she do? She's, you know, she's working full time, she's got a son she has to think about to look, you know, who's gonna look after him. You know, I mentioned earlier about the shoulders being a place where overwhelm sits. So I asked her, I said, you know, did you speak to somebody about the whole situation? She's spoken to her mother. Left side kind of represents the female. So I was like, okay, so it's a female who spoke to her, that something happened. And when you think about your filters, you know what I said earlier about the words that you speak? They are important because as a parent, your words will drop right into your child's mind, into your child's heart, into your child's psyche. You're speaking over that child, whatever that may be. But also, for her, this lady, her filters would have been wide open. This is your mother, someone who raised you, held you for 9 months, etc., you know, in her body for 9 months. So whatever her mother said to her, was, had affected her, because I said, I listened to what she said, and I said to her, you know what, you're a great mother. You're doing a fantastic job. It is not an easy job. Even when you have two parents who absolutely are committed to the childcare, parenthood, and everything. And you know what happened? She started to ugly cry. Like, she was sobbing loudly in the room. She cried and cried and cried. I was like, okay, that's what she needed. And then we finished, sat her up. We were doing, it was like a physical movement, by the way, because I work with movement. Twisted her around, and I did the other side, she was fine. And then I got her to do a position that required her to put her arm up here. And then she was there, she was doing it, no problems, both arms up in the air. And I said, look. She went, look at what? What are you talking about? I said, look. She was like, what? I said, look at your arm. And she went, oh my God! She started screaming. She's like, oh my God! She literally, there was absolutely nothing wrong with it. It was all fine, healed, all good. And she was just like, I cannot believe that I've had this problem for 6 months. By the way, that took me an hour. So we were done in an hour. She was fine with the shoulder. So the words you speak are important. Your filters are important. For yourself, filter them. And holistically, look at the 360. And for me, I don't want people going through life like the walking wounded, because we weren't designed for that. We just weren't. So I suppose to be fair, it was God's guidance. We created something called Aligned Movement. Can I have the next screen, please? Next slide. Aligned Movement, which is a 7-pillar methodology. It's to help women process trauma out of their bodies using biblical wisdom and movement. And so it has, the 7 pillars are analysis, awareness, action, affirmation, adjustment, alignment, authenticity. But it looks at the person on a 360-degree turn. And I want to share some of the tools that I've used in my experience. So if I can have the next slide, please. If you want to just scan that that QR code, sorry, you should be able to download the first chapter of my ebook, which has a little bit in there. So something to read, and obviously reach out if you want to know more. If you know anyone who needs help, please reach out, and I'd love to work with anyone who feels that what I do is helpful. So thank you so much for listening.
Thank you. I am the founder of Unit Empowerments, and Unit Empowerments is a place that people go to begin living a life that they can love. It's really a beautiful place. Firstly, I am so glad to be here. When I look around the room and when I heard about this event, what I see here is more than just professionals. I see more than business. I see more than network. What I see here is community. Community is so important to me because it has shaped every single step of my journey. So what I'll be talking about here today is just letting you know a little bit about me, let you know what my story is. I'll be letting you know a little bit about Unit Empowerment, that's my business, and let you know what my vision and my values are. So firstly, before we begin, I want to go into asking just 2 simple questions. These questions are not designed to try and get you to expose any of your deepest and darkest, but if I can just ask, who here, all I want is a show of hands, who here has experienced ill mental health? Okay, see a few hands, thank you. My second question is, who here is carrying trauma? Who here is carrying trauma? Thank you very much. See a few hands. Okay, thank you. So I've seen a few hands. Thank you very much for your hands. And it's good to know that you're aware of your traumas and your ill mental health, because mental health is on a spectrum. The truth is, the answer here is all of us. We're all carrying poor mental health at some point or another in our lives, and we are all carrying trauma. So trauma is on a spectrum. We have one end that's, they refer to little t, and the other end is big T. I don't like the terms little t and big T because for me it insinuates that one's trauma is less significant than the others. But trauma is not what's happened to you. So just to explain trauma, because I saw very few hands, I was hoping everybody would have their hand up, because then we're aware of our mental health, because we all have it. So with trauma is not what happened to you. That's simply just the traumatic event. So what's happened to you is what you carry inside as a result of that traumatic event. Trauma is also the absence of something happening to you. So something that didn't happen to you. I'll give an example of being a people pleaser in your adult years because in your childhood, perhaps you were not accepted as your authentic self. So as a child, you started to do things to please your caregivers so that you can get accepted. And that went through to your adult years. That is trauma. You're carrying a trauma of people pleasing because when you get to your adult life and say, who am I? I don't really know because I've spent my whole life trying to please people. So with that said, I'm going to go into a bit about myself so you can know who I am and how I've come to be the person I am today. So I was born in Zambia. Today is about health. I'm going to lean on my psychotherapy side of things. So as you can probably gather, both my professions require me to deal with or face society's darkest realities: crime, trauma, loss. And then to carry those with strength and composure and courage. Yet those early traumatic experiences that I had, they stayed with me, shaping the way in which I saw the world. So why did I choose counselling? I chose counselling for two reasons. Probably a few other reasons as well, but two main reasons. The experiences that I went through in life, they lingered, they triggered me in different aspects of my life, all the way through. And another reason was, as I went through life, I listened to other people's stories. I connected with people, and I could tell that people are carrying pain. Everyone is carrying around silent pain. So what I wanted to do is be the presence for them that I didn't have for myself. What surprised me the most when I went into my training was that, in order to train to be a therapist, you also have to receive therapy. So when you receive therapy, obviously you're in the client chair. That really shocked me because I wasn't ready for the stuff that I needed to uncover and the stuff that I needed to work on. But therapy gave me a safe space. It gave me a safe space to place and understand and transform everything that I had been through. And that's why I love therapy so much. When I trained as an integrative therapist. So I'll just explain what that is. Integrative is where you're widely trained to be able to use different tools, different approaches, and different ways of working. So I chose that modality not to limit myself, because everybody I met in life needed something. And I wanted to be able to meet people where they are, with whatever they bring, and walk with them in whatever way I possibly can. So therefore not limiting myself to one side. And I knew early on that if I limited myself, I couldn't necessarily work with absolutely everyone. I know one person can't fix all, that's why community is important. But I knew very early on that humans were my thing, as I didn't need a thing in terms of therapy. I worked within suicide prevention, that was my thing. I worked with grief, end of life, that was my thing. I worked with crime and trauma, that was my thing. So integrative was the thing that I chose. So now, how does business meet purpose? What are my values and my visions? So I joined the Zambian podcasting hub during the pandemic. And at that time, I already had my own podcast, which is Emotional and Mental Justice, and it talks about all things mental health. When I joined that podcasters hub, no matter who I spoke to in those podcasts, and the voices were amazing. There was just so many people telling so many stories about different things, and I think the pandemic itself forced us to be able to come together because we were all indoors, we were all, just speaking to each other, connecting via the internet. And I was so amazed by the fact that every single person I spoke to, mental health was a factor, and it wasn't because I'm a mental health practitioner, it's because mental health is just a thing that everyone is carrying. But the thing that really saddened me was that I noticed during that time how much of a taboo mental health still is in Zambia. There's so much stigma attached to it, so much shame in being vulnerable or even admitting that I have mental health. I don't know if anybody here didn't raise their hands because of that, possibly shame or anything, or if you're just not aware that you may have suffered mental health. But during that time I also was doing some Instagram lives, and the amount of Zambians that reached out to me, whether it's secretly seeking therapy or seeking advice or seeking a safe space because they didn't have those spaces. at home or within their community and friends. So around that time, I was also doing a lot in the community here in the UK. I was honoured with a Community Spirit Award. It was for the recognition of positive impact on the community that I had made. So I was very, honoured to receive that. But meanwhile, in the back of my mind, I had the whole pandemic situation where I'd connected with so many Zambians, and mental health is not so big there, and I needed to change. There's just a shift that needs to happen, because I feel that I've been blessed with the gift of having to be healed to an extent, having experienced therapy. So I want more for that in Zambia. So those Zambian voices lingered, but then I go back to that Community Spirit Award, and it tells me that my journey has value. It tells me that giving back to the community makes a difference. So then what can I do in Zambia? Not shortly after that Community Spirit Award, I founded Unit Empowerments, and Unit Empowerments is not just therapy. It's a space of healing, hope, and transformation. It's a place where you can receive counseling, therapeutic workshops, empowerment coaching, and it just gives people the tools to rise, to grow, and to transform. So with those lingering voices, I decided to do some research in Zambia about how I can help or do something. So again, I had the privilege of interviewing and just speaking to a load of healthcare professionals in Zambia. First place I targeted was Chainama Hospital, which is our biggest psychiatric hospital in Zambia. I spoke to a few psychiatric doctors and nurses, and I've spoken to lecturers at university, I've spoken to university students. Again, mental health, is something that's absolutely needed. That stigma, those labels are there. The reason I targeted Chainama first, I spoke to a girl during the pandemic, and after, we're still in contact, but she had visited Chainama Hospital as a patient. There's still this thing of Chainama being a place where, these are not my words, but people in Zambia a lot of the time refer to it as mad people, I had spoken to her, and she had a really traumatic situation where she lost her parents, she lost her grandparents, she lost everything she had. She was ill-treated. She went through anxiety and depression. It was clearly that. But because she had been to Chainama, she obviously wanted help. She went there, she got the help, she was taken there. She came out, and when she had gone in there, all she had was depression and anxiety. By the time she came out, what caused her to become suicidal was the community, because of the fact that she was labeled. She was now, oh, you've been to Chainama, you're mad, you're all these labels that we must be aware of. That really saddened me. And so I started to do this research, and I've spoken to so many people. So what my vision is really in Zambia is to create safe spaces. Safe spaces for mental health. I think Zambia needs spaces where mental health is prioritized, where stigma is reduced, and where young people feel supported and inspired to thrive. So I guess that's my talk. My call here is, I'm looking into that. I'm at the early stages of trying to, create these safe spaces. But if there's anybody here who has similar visions or values or wants to connect for any reason, please do. My QR code is over there. And if there's an issue with it, I have my QR code here if anybody wants to connect with me. Thank you very much.
Moving on to the next speaker. We've been rehearsing names. And I hope I get it right. Mr. Moet Mumba. Mr. Moet Mumba is a healthcare executive whose leadership spans over 15 years across the UK's regulated care sector and Zambia's emerging private healthcare. He's the director of One Healthcare Solutions, and a UK-based consultancy. He holds an MSc, I do beg your pardon, in healthcare management, and credentials both as a registered nurse and as chartered manager. I hope he's still in the room. Guys, I might lose my job after this, right? Prank me. He's coming. How did I do in the name front?
You made it. So thank you very much. I'm really glad to be with everybody. And it's always very nice to be hosted at Zambia House. It always feels like we're back home, isn't it? Yeah, it's always good. It's always good. Cool. So my name is Mweti. I've already been introduced. I'm the director for One-to-One Healthcare Solutions. A Zambian trained nurse. I have been a nurse for quite a long time, actually. Long time. And I've been in healthcare management and in consultancy for the last 15 years. And with that concerns dealing with CQC compliance and commissioning of new services and all of that headache that comes with with healthcare. But I do enjoy it, and I've still kept my PIN number as a nurse. I haven't practiced as a nurse in a long time, but I always feel like it's very important to keep what sets you up to what you're doing, as your day job. So I'm going to share a little bit about healthcare strategy and workforce solutions. If we could go to the next stage, that just introduces who I am. That's how my name is spelled. I don't know why everybody says Mumba. It's Momba. Momba. It's a very Tonga name. Easy. Let's go to the next slide. Yeah, and basically that is what we do. So I'm going to launch into what I'd like to share with all of you. And by the way, what beautiful presentations we've received so far. Really, really good. I think sometimes we kind of just gloss over some of these things. I think when you listen and you hear and you understand, good stuff has been shared in here. So thank you to everybody that has spoken before me. That was really good. Okay, so I would like to speak to people that might have an interest within the healthcare sector. As introduced, not only do we have an interest with healthcare within Zambia, we've also invested in private healthcare in Zambia, more specific in Livingstone, in a private clinic, and I'm also a director of Sunset Hills Memorial Park Cemetery, which is coming up and opening shortly in Zambia. So we are very much on the healthcare spectrum, and now just going across into dealing with and more beyond end of life into respect for the dead as well. And I think that's a bit of a taboo subject amongst us, isn't it? Yeah. And I no longer think like a nurse anymore. Okay, I think like a businessman, because one of the things we do as Africans is we don't really talk about death. We don't really write wills, but we spend a lot during a funeral. So I thought, let me open a private cemetery. There you are, because I know. So at the end of the day, I think these are topics that we should talk about. These are things that are definitely going to happen. Whatever religion you are in, that is the one thing we all know is going to happen to each and every one of us. So if you haven't written a will, please, I would encourage you to write one. If you haven't thought about what should happen to you, after you die, think about it. Now I digress. Let me get back to my topic. Okay, so in terms of healthcare investment within the UK, I think that's one of the things that is very, very dear to my heart, because when you look at the makeup of the workforce within the UK healthcare industry, it's made up of majority people like you and me, in terms of the workforce. And I always try to challenge people to say, if we can drive the chains and the wheels that make this industry go around, why can't we be entrepreneurial about it? What stops us? And all it has to take is a bit of a mind shift. We have to think about the opportunities. When we think about opportunities, A lot of people would want to say, oh, let me open home care, let me buy a care home. And what we need to do is to look at where the opportunities lie. And where do the opportunities lie? Look at the area where you want to invest. Look at what the plans for the local authority within that area. What are some of their priorities? And look at the demographics. One of the things is we have an aging population within the UK, isn't it? Good healthcare makes people live longer. So you already have a ready market. No, and I don't want to look at people as commodities, no, but I look at it as providing a service. Because in the absence of those services, those people would have no care provided to them. So if we were to bring a brand and bring companies on board that were going to provide services that would meet people's expectations, that would meet people's preferences, we would be meeting people, in terms of what they really, really need. When we look at, the other group, we have a huge demand for, learning disability, and autism in this country. Again, those are opportunities that are not really, really, they've not yet been identified as much where we come from. How about we dab into them? We have a good understanding. How about we are able to then transmit that knowledge and be able to open a similar thing, back home. We use that knowledge. I like people that are that are vulnerable enough to say, this is what I'm going through, this is my situation, however, this is what I've learned, whether it's looking after an elderly parent, majority of the time, like I think somebody said, we don't have care homes in Zambia. That's quite strange, isn't it? Quite strange. Do we know who looks after the elderly in our homes back home in Zambia? Family, it could be a maid. Now, all those people are untrained. Have we ever thought about, how dangerous all of that is? Okay? Now, we cannot just be good carers or caregivers or care providers in the sense of a company back home without creating a template in a country where we are at the moment. One of the things the UK has is a regulatory framework. And if healthcare has a regulatory framework that we can then transpond and be able to use as a benchmark, whether in our business, in Zambia or elsewhere, you will find that you will be able to change the healthcare landscape back home. When we look at the health, I go back to the workforce, we talked about majority of the workforce within the healthcare sector is foreign, isn't it? A good amount. This is why, anybody ever heard of COS, the famous COS?
Yes.
Okay, why was that brought about? Foreign workers, isn't it? Yeah. I remember as a young man being interviewed in Zambia, recruited as a nurse, and I came to work here. Why? Because even back then there was a need for healthcare workers in this country to come and work as a nurse. And one of the things we need to be able to see is you have to have that ambition in you to move from being just a worker to how can I own? Okay? Now, I deal with quite a lot of different companies, whether we are commissioning a hospital or whether it's a care agency or related like CAMS or Children's Home and Ofsted. I tend to find that one of the things that we really are not as strong on is things like creating business plans, strong business plans. It's things like talking to your bank. Do you even know how much the banks are lending money at for care providers? It's very low. They're literally encouraging people to go and talk to them so that they can invest. because they know that that's an industry that is strong enough that will still be around for a long, long, long time. When you talk to people about marketing, a good number of people, I don't know, just not really as strong on marketing. You know, they will maybe rely on somebody just giving them a service user, just from a conversation. Oh, I can give you. No. Do you have a website? No. Do you have a business card? No. How are you going to run a business? And I see this repeatedly. And when I speak to my own people, I tend to think that when you think about your competition, okay? So your competition is got a website, they've got a business card. Not only that, they probably have joined Skills for Care, so they are already attending meetings in those places where care is being spoken about. They've maybe met the commissioners at the local authority. Those are things that we can pretty much do on our own if we do want to create a healthcare investment and company that would outlast us. I always say to people, do not create a company just for you. Create a company that outlives you, okay? Because if you make anything now, I'm sure Swenga sausages will be there 100 years from now, and they will be talking about our great-granddad created this. That's what you want. That's what you want. What opportunities are we leaving them? So when it comes to returns within the healthcare, you will find that the returns are good if you are disciplined enough. Okay, if you're disciplined enough, the returns are good. But we know of a huge number of companies that have been shut down because of abuse of COS. Okay, again, that was because people wanted to make quick money. Okay, if you're disciplined enough, you're making the good strides. You are keeping your CQC ratings okay. Keep it to outstanding. Keep it to good. That will always give you contracts with local authorities and with commissioners as well. You have got to make sure that above and all, you look at what everybody else is providing. Don't be a one-trick pony business. Think about what do we do next? What are our competitors doing? How can we outsmart them? If people are doing, are looking after just looking after the elderly, 18 to 65 and above. How about adding in the children element? Because now you can have both Ofsted and CQC registration. So think about those things whereby you can get supported accommodation that takes in children from age 13. When they get to 17, they can go 16, they can go into your supported accommodation. Supported accommodation, they can still leave as care leavers after that. So you've got a long stretch of income. Quick things I'd like to throw. CQC 101 for investors. So you make sure that you have very good knowledge round about how CQC works. How many people in here from the healthcare sector? Good. Good. How many have been involved in a CQC inspection? How many found it good? Brilliant. Yeah. I like that. Okay. So the way I always tell people is a CQC inspection should be something you look forward to. Okay? Not a lot of people think like that. But if you are prepared, you will always look forward to them to come in, because your improvement and your learning is happening on a daily basis. So make sure that you are aware of regulatory framework, roundabout single assessment framework, the quality statements, the quality of staff you employ. Do they carry your vision? Do they carry your ethos? Have they learned what you really want to do? Or is it just a case of just employing people? Compliance, and this is the bit where we come in. Compliance risk, that you carry on a daily basis. How much do you know in terms of ensuring you're always compliant? Because if you're not compliant, that is your business gone, isn't it? Cool. Let's quickly go to the next slide. I quickly just want to talk to you in closing just about CQC. So basically, CQC is an independent regulator. You've got to understand the registration requirements, understand the step-by-step. There are a lot of people that would, the whole process of applying has been changed now. Very, very much so. And you've got to understand all of these things before you actually venture into the business. Next slide. Next flight. It's because I'm on a flight in a few hours. Who are CQC and why compliance matters? As I said, they're an independent care regulator. They do carry ratings. And as you know, from our job, we tend to know in terms of how, the changes, if anything, there's some more changes coming to CQC. Those ratings, there are certain services that have not been inspected since 2018. We've got some of our clients that haven't been inspected for the last 7 years. So imagine if you carry a poor rating and you carry it for 7 years and how that affects your business. Legally you cannot operate without registration. Let's go to the next one. Okay, so types of regulated activity. There is mostly personal care that is attached to domiciliary care. There are a lot of other regulated activities, whether it's a residential home, whether it's treatment of diseases, that all comes under different. Let's go to the next one. Okay, so pre-application, like I said, create a strong business plan with financial sustainability. Don't just do it on the basis of, I want to open a care business and then you wing it. No, have a minimum of 6 months worth of funds to operate, believing that you have no clients. If you do get them, that's good, but work on that assumption and then you will be in a better place. You need to have robust policies and procedures. You need to have a governance structure. So that means you need to have an RM and an NI. Governance also covers things around your audit system and what really keeps your organization compliant with CQC. Ensure your premises and IT systems are all ready. Quick thing to note, if you're getting an office these days, CQC really are very strict on access for the disabled people. So if you do get an office on the upstairs and there is no wheelchair access, that might go against you. Key roles, let's go to the next one. I've explained that. So application process, these days you have to email them in. We used to have a portal. The portal has been paused a little bit because CQC made a mashup of it. I won't tell you a story behind it. Complete the online application or the paper application. You need to have a statement of purpose that actually describes what you do. DBS checks, these have to be enhanced, and fit and proper persons test, that goes into looking at whether you can be a person of, in a position of trust to work, because you're working with vulnerable people, as well as having to pay fees and pre-registration interview. So that's an interview you have to go through. Let's go to the next one. And then those are the fundamental standards for CQC, very important for you to know. And I'm more than happy to email any of these to anybody that will want it afterwards. Let's go to the next one. Okay, so preparing for an inspection, you need to have the evidence of your compliance, your training records, your quality assurance, feedback or from service users, and any mock inspections, which we do, and then you can also have your internal audits. Next one. And basically there we are, and that is what we tend to do, and that is where we come in and support you. Okay, we take the headache and we take the heat, but all in all, I would like to encourage everybody to say, do venture into healthcare. healthcare is big if you do it right and do it very, very well, because we are looking after human beings who are loved ones. Thank you very much.
Awesome, thank you very, very much. One point that I took from that is that in Zambia, when loved ones are looked after by either maids or family, or in some cases they get brought together, but the sense of family that they're not trained, they are not. And then itself, that is very powerful if you think about it. You have to be trained to know how to handle a person. So that was apart from everything else, that was a good take for me personally. All right, so our next speaker, we had a very powerful session on enunciation and pronouncing. So I will talk about this speaker. She has an amazing experience spanning over 22 years. So Dr. Vimbai Nashe Kandeke is a trailblazing healthcare professional, with over 22 years of clinical and leadership experience across Zimbabwe, Zambia, and the United Kingdom. She is the founder of MyTenor. It's a doctor-led digital health platform. She's redefining personal health management by empowering individuals to take active control of their well-being through accessible, science-driven care. Ladies and gentlemen, please help me to welcome Dr. Vimbai Nashe Kandeke.
So, when Sean shared what this speech was about, this event was about, I was very excited. It touched on all sorts of things that I find extremely exciting, that keep me up, that have been keeping me up and excited since, time immemorial, since before I started my career. So I'll throw a few words at you. Autonomy, control, cost management, and convenience. These are all words that appeal to all of us when we think of any technological advancement. So it's not only in health. When you think about, mobile technology, you're thinking that. You're thinking about AI industry, that's what we're talking about. So it's all uniform when we think about technological innovation. Now, hands up, I suppose, if you've got a car. Gosh, when we're in London, nobody drives. Keep your hands up if you know how much fuel is in your car currently. Yeah, how much fuel is in your car at the moment? And keep your hands up if you know when your next MOT is due. That's... All right, well, all of those people that got their hands up, please keep your hands up if you know what your blood pressure trend has been the last month. Oh, I'm impressed. How many of you know what your cholesterol is? Etc., etc., etc. No. We spoke, a few speakers today spoke about the things, especially Umweti as well, about things that we don't speak about as people, especially in Africa. We don't speak about death. And I'll be to say we hardly speak about our health. We speak about our health, but we don't actually speak about our health. We talk about, oh, so-and-so is not feeling well, oh, we need to put together money for this and all that. But when we think about ourselves and the people we care about, we're not talking about the actual things that drive our health. So I asked you about your blood pressures and so forth and things like that. I want you to think about yourself in taking care of, so we think, oh, they're taking care of my mental health, which again, we don't, I agree with you now, we don't talk about at all. We just really don't talk. So my passion is, I want people to be able to take control of their health, in the sense that I want you to know what's driving your health, what's keeping you healthy, what's keeping you unhealthy, what do you need to do. We invest in healthcare, we invest in, if you think about back home, we invest in our medical insurance, we invest in all those things, but we don't actually look at the true representation of what we're getting for what we're paying for. So when we talk about control, when we talk about control, I've set up my business called Maitano. So Maitano, for those that speak Shona, you'll understand the word Hutano, which means health. And it's a sort of a play on words. Maitano means essentially my health. So what I want people to be able to do is to connect all the things that keep them healthy. We're talking about your weight, your metabolic drivers, what you're eating, what's happening with your prescriptions, what's happening if you're looking, in terms of second opinions and all those things. So essentially we run a medical concierge where we're connecting you to all the services that you need. You might need, I need a referral. I think I might need a referral to your specialist. I don't know how to go about that. And sometimes things take long. Or I've got no time to see my GP. Or I've got my mom visiting from Lusaka. She forgot her medications. What do I do about getting her medication? Or I've just had so-and-so, we spoke about the COS, for example. People have had family moving here. They're not registered with the GP or they don't have time. I need a prescription. I need to ask a doctor, do I need to see somebody about this? Am I okay? What's this worrying about? So at any point, you've got control and accessibility to what you need to take care of for yourself. We're thinking about Ubuntu. I'll drive us back to Ubuntu and sort of touch on my career as well. So my career started in Zimbabwe, where I was born and trained. And during my early years as a doctor, the things that obviously you go through different specialties, and the things that stuck with me and still stick with me today are the patient stories I heard along the way. So I remember people. I remember, it's also a curse in a way. I remember people, I remember names, I remember faces, and most importantly, I remember their stories. But the stories are what then stuck with me. So you get somebody, they're struggling with this aspect of their health, but then you realize, where they're coming from, they don't have access. I worked in a tertiary institute for a while, so you've had people that have been referred to them from the middle of wherever with complications over things that could have been handled quite easily in a clinic if they had access to it. You didn't even need a doctor there to sort this out. So it carries on, and unfortunately, or fortunately, we have quite a lot of experience with private healthcare where we come from, which is quite different to here, where almost everybody back home has got access to some sort of private healthcare, which gives you autonomy and control, because then you can ask, because you're paying for it, you can ask, what does this mean? Am I getting the best? Can I get more? Which sadly, I think maybe on this side of the pond, people almost defer. You almost don't have a chance to ask as many questions. So when we talk about innovation and all sorts, we think it's going to come from more developed nations. But if you think about our experience and the things that we ask for, our doctors, our pharmacies, all those things at home are very experienced in terms of patient care and issues of patient control and all this, because you are paying for it and you're asking for more. So what I want to encourage in terms of patient advocacy is for people to ask more questions, have more understanding. You've had a test, you've had a medical test done, you've had a blood test done. Why do you not have access to those results? Why do you not know or store them or keep them to know where to reference where you came from? Where were you a year ago? Where were you 5 years ago when this happened? I've had a problem now, but where are we coming from? All this information is yours. And which is something that we're driving towards even in patient advocacy, where we want to encourage people to, we want to interact with our patients, we want to share, we want to help you to make choices for your health. It's not just, I've been to the doctor, I've been told I need to take this. You've got obviously the power to make a choice, this doesn't work for me because of A, B, C, D, and I feel I need this, but I've heard this, which is something that we talk about a lot in our communities. People will tell you, I'm taking this for my blood pressure. I'm taking this. But so-and-so, they've been taking this, they've been having this diet. And it's all conversations we're having in the community, but we don't take it to the front face of medicine, where these things actually actively drive the decisions that make your health a failure or a success. So I encourage, I encourage always for the dialogue, which then comes again to the spirit of Ubuntu. What are we talking about? Do we understand where you're coming from? Do we understand where you're going? Do you understand where we're coming from? Have you got the capacity to understand the information that's been given to you? Is it accessible to you? Is it convenient for you? Can you afford it? How can we help you to split the costs of your care and all that? So MyTano is a business that runs in the UK, and people struggle to imagine, why do I need private healthcare? I've got the NHS, but the face of NHS is evolving, it's changing. We don't have hours to sit with our GP and talk about all the things that are bothering us. You got your 10 minutes, choose your battle, come and talk to me about what you need, and that's it. Or this is what's going on with you. I just want to talk to somebody who understands. I've been given this treatment, I've been taking this medication for the last 20 years. Am I getting what I need to get out of it? Am I okay? I want to stop it. I'm not, I think it's got the side effects, and then you've got an opportunity. So we put you in contact with all of those aspects of your care. So that's what we do. In terms of wealth and health and the digital future of medicine, I think it's very exciting. We've had a few speakers today speak about the changes that happened with COVID. That was quite a transformative phase for all industries, including health. So the digital health and telemedicine and all that really leapt forward during that time. And honestly, there's no going back. We're just going to go forward. Namunji was speaking earlier about the ability to monitor patients from their homes, in the comfort of their homes, for different reasons. We want things done in the comfort of our homes, and we get better patient engagement that way. So even at MyTano, so we offer access to laboratory care from the comfort of your home. You've got the same digital monitoring tools and all these things that can be done from it's amazing what you can get done remotely these days. So I encourage you all, as you sit and you think about your own personal health, how can you take control of it? What aspects of your health do you know? We spoke about mental health, we spoke about death, we spoke about all those things. We want to get a nice little soup, so to speak, where you are aware of where you stand with your health and in all aspects. And that's what we all hope to do. And I feel the future is that people understand that they've got the power, they've got the control, and it's their right to have all this knowledge, and you ask for it. It's different. I remember when I was studying in medical school, the doctors were all big and scary and at that point, and no one dared ask anything, and that's how they ran their consultation rooms. I'm the doctor, I'm going to tell you this is what you need, go and do this, and people don't speak back. Oh, the doctor just said, oh, but you're not going to explain that. Oh, I can't take those tablets because I've got a fear of swallowing this, I got all that. We want to engage. So control, autonomy, and choice is the future of medicine. And so all the tools that we are pioneering and encouraging are to really share that, to disseminate that those capabilities to everybody who needs them. And we're here. I'm here. I love questions. I love taking questions. I will talk to death about anything. My background is obesity medicine, and that's where Namunji and I really bonded. I worked, but then people don't realize that, again, that's a nice sort of interface of medicine, in that it touches on all these human elements: what we're eating, how we're moving, how we're feeling, the impact of our weight, and you're talking about stigma and all that on people, and then it touches on our metabolic health, hypertension, diabetes, all those things come together. So I think it's a beautiful interplay of health and Ubuntu, and yeah, please, let's talk, let's connect. I've had so much inspiration today from a lot of the speakers today, and I look forward to getting in touch and getting this going. And thank you to Sean and the team for setting up this platform and the stage for us to speak. We never really get opportunities to meet so many diverse areas of health that we don't realize actually connect. You talk about epidemiology, mental health, death, and aspects of wealth, and all those things. Those are all important. So let's. Oh, sorry. There's a question from Steve. So my channel is a we run a website. So on this website, you've got ability to book the kind of appointments you need, and then we offer virtual services depending on what that is. So you will have a virtual meet and greet with whoever it is. We give digital media. We send out if you need blood tests, or if we need to. The only thing I suppose we can't do obviously is do CT scans and that sort of thing from home. But we do have a network of private hospitals that we work with. You're able to get all that done as well. But yeah, and so forth. So we work with psychiatrists, psychologists, nutritionists, and that sort of thing. So we've got quite a nice network. And like I said, it's a concierge service of sorts, so we're able to connect you with all these things as you need.
So Nocturnal Recruitment started 2019. Through the pandemic, it was difficult to actually run a business or start anything because everything was shut down, so you couldn't even get a contract. So I did struggle for a little bit. Ended up doing a master's whilst I was waiting for things to open up. And when they did, right at the end of my dissertation, it's like everything just opened up, and then I had to be in all these places doing all this stuff by myself, and then got my business partners on board. But lucky enough, as people say, when you start a business, usually many businesses, 80% of businesses don't last more than the first 2 years. But we managed to pull through, and I think within the third year, we're able to achieve revenues of over £1 million. And when you go through that and see the possibilities, it kind of encourages you and pushes you to keep on moving forward. Moiti said, look, there's actually a lot of money in this business that we don't know about. And then when you start seeing it firsthand, you just think, wow, we've actually been sleeping. Because at the end of the day, health and social care, the majority of the workers are ethnic minorities, be it black or Asian. But how many of us actually own the businesses that generate that income to come into our household? Not many. We're actually the workers. We were meant to be the business owners. So the question, the challenge to you is, what are you doing in your own space to actually generate some income? Instead of being used by somebody to generate their income. Where do you stand? Okay, so I'll jump fast forward because, like I said, I'm not going to talk much about health and social care because Moish has spoken much about what you need to do. I'll speak about the other organization that I run, which is called the Basics Project. Now, that's come up through the ethos or the habit of, like, Jewish businessmen do the tithing, whereas they give a percentage of their business profits to charities and stuff like that. So we employed the same kind of principle in our business as well. But the question was, what do we actually invest in that's charitable, in terms of working that's worthwhile, in terms of our profits? And for me, I've always had a conviction to say you have to give back home. So like I said, the majority of our workers, 90% of our workers are of African origin in terms of care workers, nurses, support workers and stuff like that. So we thought Zambia definitely is a good point, a starting point. And how it started is a little story. When my cousin died in Kafue, he lived next to a village in Kafue. And after the funeral, I called in to just check in, how did the funeral go? And I was told there was a group of about 40 kids with their mothers at the funeral. And the mothers were crying, saying, who's going to take care of our kids now? So surprisingly, well, my cousin died in a road accident. He was only 30 years old. But he had adopted these kids in the village to keep them from vices, and sponsored them in terms of registered them in the football league. He used to buy their kits and stuff like that. So they'd come to his funeral. So the mothers were complaining to say, who's going to take care of our kids? And apparently the last money they had, they donated to the funeral, towards the funeral. And they were like, oh, the kids are now going to be kicked out of the league, of the local village football league because they've donated the money. I asked them how much was this money, and they told me it was only 500 kwacha. Exactly my thoughts. So I thought, how much is 500 kwacha? And I was told it's £20. So I thought, how can these kids lose out and be kicked out of the football league because of £20? So then I said, you know what? I'll take on that responsibility. If that's what they need every month, I'll sponsor the team so that they can continue. You don't have to stop. So I then said, let me get in touch with the coaches and somebody who can help in his absence. And I said, I'll pay you to actually start taking care of these kids. And we need some form of structure to kind of see how we can actually help. Now, as you know, this is 2023. As you know, there's free education in Zambia now. Of those 40 kids, 90% of them were not going to school. And I'm thinking, why are they not going to school? And I'm being told, well, even if you go to school, it's free education. If you don't have books, uniform, and school shoes, you're kicked out. You're not allowed to attend classes. I asked, how much is a book? And I was told it's about 18 kwacha for one. And that's less than 20p, or about 20, 30p for a book. And I'm thinking, so kids are actually being given free education, but they're not going to school because they can afford what? The books. Now, understandably, the poor people in Zambia, or the underprivileged in rural areas, live on less than $1 a day. So let's just say $30 in a month. How many of those can actually afford new shoes and school bags and books for their kids? Some of them have got 5, 6 kids. It's not a priority. So then we decided what we're going to do is sponsor all the kids, pay for their books and school uniforms. And I said, look, let's structure this in a way that we can make sure that every kid that comes to play is actually in school, and we make sure that they actually do go to school. And that's how we started. But as it goes, you start discovering there's other issues with those kids in terms of their health and needs at home. We thought, let's get the girls involved as well. We started the netball team for the girls. Simple issues like sanitary pads. If we're talking about people earning less than $1 a day, do you think they can actually afford to buy always pads? They can't. So then we thought, how are we going to support them and help them? We registered them onto some workshops in Lusaka, drove them all the way to transport them to learn how to make reusable ones. But again, for it to be sustainable, we need obviously continuous support in terms of materials and stuff like that. But also, we don't want it to just be in one village. We're thinking, if this is happening in one village in Kafue, which is not even that far from Lusaka, what's happening to the ones that are deep, that nobody even cares about or knows about, there's no road access? How do we then help those ones? And that's why I then decided, you know what, let's just register an organization. It's called the Basics Project. Now, the name is self-explanatory. Like the guys that are doing the doctor stuff, it's amazing, and I don't shoot it down. I think that's great and we need it. Most times we're talking about STEM and people donating iPads and stuff like that to these schools. But do we actually realize that some of these people don't even have the schools to start with? There's issues of load shedding right now, even within Lusaka itself. So what's an iPad or a computer going to do for kids in the village that doesn't even know what electricity is? So how's about we go back to the basics and provide those little basic needs, like providing the books and making sure that kids can actually attend these classes that they need to go to, right? That's how the Basics Project was born. It's a platform where we do things project by project, so that when funding runs out, one project is finished, we just hand it over to the community. So for it to be more sustainable, other than like somebody mentioned, USAID stopped funding, so it means a lot of charities had to shut down because they depend on the consistent funding from other people. So I said, look, if we have an organization where anybody that wants to do a project and have got the funds to do it, we can do that project, fund it yourself or raise funds, and then we can deliver it for you. So if you're in the diaspora, like in London, and you decide to do something in Zambia, you don't have to go through the onerous things of having to register your own charity, because how many charities are we actually going to register? When we can just have a platform where whenever we need something to be delivered to the community, we can actually do it through one platform. So it makes it easier, and when that project is actually done, then you move on to the next one because you've handed it over. So that's the whole basis with the Basics project. And we started, first of all, with like drilling some boreholes in some of these villages. And then part of the story of the kids in the football team. So end of 2023, one of the kids in the football team was playing collapsed. And then they rushed him to the nearest clinic that they have within Shimabala and the village there. It serves about 3,000 to 4,000 people. When the kid got to the health center or the clinic, they said they didn't have the medication, they didn't have this and that, and he had to wait 4 hours or walk 12 kilometers to Kafiwe General Hospital. Now I'm thinking, if you've collapsed and you're ill, how quickly can you actually, how is it possible for you to actually get to the hospital if you've collapsed and you're ill? So by the time they got him 4 hours later, he was pronounced dead on arrival. So for me, it was very personal because it's a kid from my team. And then I went to investigate to see exactly what health facility they had. And this is what the biggest clinic or health facility they had in there. And to anybody that knows, that's literally in Denver. And in there, there's BP machines and stuff like that. So we thought this is bad for the kids and for the people in the village. And that's actually on a military base, which means the military personnel at the base also use this thing as well, which is deplorable. And so my colleagues and I, our company decided to say we're going to build a clinic for the community. And if you go to the next one. This is a gentleman outside that little clinic. He's in a wheelbarrow. That's his hospital bed. And he's on a drip. So this is how bad and how terrible healthcare service is. Not more than an hour from Lusaka. Next one. And that's a baby that's actually died at that outside the little clinic as well. So there's no mortuaries, there's no nothing. Literally, women give birth outside under the tree, whilst other patients are watching them. And again, you're thinking this is 2023, 2024, and that's in front of a military base where we'd think the army or the government is actually going to do more, but they don't. If you go to the next one. So we had a vision to say we can probably sacrifice our profits and build something for them. And we started that project last year. And as of this year, May, we finished building. If you go to the next. And that's what we've produced for the community. So the funny thing is that the army told us, oh, I was looking for land because the headman has sold all the land in the area. And so we asked those guys, can we expand that little thing that you have? And they said, no, the land you see on the left side has been allocated for a clinic for the past 15 years, but nothing's happened. So you guys can go ahead and have that. So that's how we collaborated with the army to help us build with the engineers, and then provided all the funds for the materials and stuff like that. If you move on to the next one. So that's the full clinic that we have to replace what we have. The last one. And that's my team. So those are the guys that I work with, my partners and some of my workers in the London office that actually flew into Zambia to kind of show them the kind of work that they're doing to help out. And obviously, they're sacrificing on their part. It was only right that we get them in. The other guys on the other side are actually work in a different company that donated the septic tanks and the boreholes as well. So now that brings me to a quick discussion of collective impact in terms of delivery of services in Zambia. As you've seen, most times we wait for the government to actually help or do things. But how many governments have actually managed by themselves to do things like this? And as people, as we are, should we be waiting for the government all the time to do things that we can actually do? Should people be dying like Samuel, kids who are 11 years old dying, when we can put funds together and resources without having to wait for the government to make a change and to save a life? So the saying goes that J.F. Kennedy said, ask not what your country would do for you. but what will you do for your country? That is something that I wanted to bring to you guys, to say we can collaborate in different ways and aspects to deliver where not only the government is failing, but we understand they've got no money. We know that. So I don't see how we expect them to do everything. Where do we play a part as citizens? Where do we play a part as the diaspora? And how are we giving back to our communities? What can you do for your country? Thank you.
Thank you very much indeed. That was very informative, educative, as well as empowering. But at the end, I think all of us, when we saw the photo of the so-called clinic, I think I was touched indeed. Thank you very much, Mr. Shamwana, you said? Okay, thank you. As you know, I've just taken over as an MC. I wasn't supposed to be an MC. My name is Henry Mumbi. We still have got the last speaker, and the last speaker will be Martin Chisanga.
Good evening, everyone. My name is Martin Chisanga, and we own a company called Shoprite Healthcare Limited, which trades as Arundel Pharmacy in West Sussex. Before I go any further, I just wanted to say thank you so much for inviting me to this wonderful event. It's my first speaking event, and I would also like to say thank you to the hosts, the Zambian Embassy, and to everyone in attendance this evening. Thank you. Before I begin, I just wanted to just to tell you a bit about myself. I was born and raised in Chingola on the Copper Belt, or Kopala as we proudly call it. This is where my story began. Growing up in Zambia taught me a lot. Taught me resilience, discipline, and above all, the value of community. About 21 years ago, my mother moved to the UK with just a suitcase and a dream, and the determination to build a better life for herself and her family, including myself. The rest of the family joined her 6 months later, and my journey my journey as a pharmacist began with a revelation from God. It was revealed in a dream to my aunt, a woman of God, Dr. Sylvia Chila, who shared this dream with my mother and eventually with myself. And from that moment, I knew I wanted to pursue a career in pharmacy. When I moved to London to study pharmacy at Kingston University, God not only gave me direction in my career, but He also blessed me with my beautiful wife, Debbie, in the audience today. And in my first year of a 5-year pharmacy course at Kingston, I told Debbie of my dream to one day open a pharmacy. And from that day, she's been my rock. She supported me, praying with me, and praying for me as well. And today, by the grace of God, I stand here not only to tell you about being a pharmacist, but to tell you that I'm also a proud business owner of a pharmacy and a director of a pharmacy. Through Arundel Pharmacy, we've been able to serve and support the NHS. We've created jobs, and we make, I believe we make a meaningful contribution to our community. We look after just under 5,000 patients, which is remarkable and sometimes stressful, but that is the price we pay for hard work. I want to share my story today as a testimony to say that if I can do it, so can anyone. the road was definitely not easy. When my wife and I decided to open a pharmacy in Arundel, West Sussex, I sought advice from industry experts. I know you touched on advice from experts, and unfortunately for me, every single one of my people I asked for advice told me it can't happen. And they told me not to do it because obviously there's a lot of money that has to be invested and a lot of time. And I was told not to do it because you'll be wasting your money and your time because the NHS do not grant NHS contracts. I am a bit stubborn, as my wife would, I'm sure she would agree with, and I still went ahead. And to some extent, they were right, because when we first tried to get an NHS contract, it was actually declined. And we did not stop, and we had to appeal. And when we appealed, with prayers, perseverance, faith, and support from the right people, we eventually won the appeal, and the NHS granted us the NHS contract. This was about 2.5 years ago now, and our pharmacy has now become the only pharmacy in our town, which again has actually just proved that determination and hard work is actually worth it. And I believe that we as Zambians, especially in the diaspora, we carry something powerful, the spirit of Zambians. I'm a very patriotic Zambian, and the spirit of perseverance, family, and unity has enabled me to succeed, and I believe it can also enable other Zambians in the UK to also succeed should we come together and work together. My message today is to let you know about never giving up. Success is not only about what you achieve, but about how many people you lift up along the way. And I urge everyone here today to support one another, to mentor younger people, and to show them that they can achieve greatness, whether here in the UK or back home in Zambia. And I believe that platforms like the Zambian Network are vital in allowing us to connect, share ideas, and build together. As mentioned before, healthcare in Zambia still faces many challenges, and we in the diaspora have the knowledge, networks, skills to make a difference. In closing, I want to share 2 important lessons taught to me by my grandfather. When I was young, my grandfather said something to me that has always stuck with me. It's a member saying, he said to me, translating, meaning, he who has a mouth will never get lost in life. As long as you're able to seek for opportunities, ask, and obviously network with the right people, you will always succeed. It takes hard work. However, it is not impossible. Those words gave me confidence growing up, and I believe that I overcame my challenges by believing that. Finally, I would just like to share a Bible verse, Proverbs 24:16. For though a righteous man falls 7 times, he rises again. Amen. This reminds us that setbacks are not the end. Even the righteous fall, but their strength is in rising again. I mentioned before that my company is called Shopback Healthcare Limited, and many people ask me that on a daily basis. What does that mean? Where does that come from? Shopback it's an area, again, in Chichester, West Sussex, where I wanted to initially open a pharmacy. And that was met with so much opposition, and I had a lot of big sort of pharma competitors strongly oppose my application. And again, that just gave me a drive to carry on. And I used that name to carry on fighting, because it was not just a failure, it's a name that reminded me of where I come from and gave me confidence to keep on fighting. So to you, I want to say that do not be ashamed to try new adventures. Do not be ashamed of failure. Do not be afraid to pursue your dreams. Problems are part of life. And without struggle, there is no progress. Together, let us build bridges between Zambia and the UK, bridges of opportunity, business and community. Thank you so much for listening to me, and thank you.
Thank you very much, Martin Sanga here. Musonda, thank you very much indeed. It's never impossible. It's never impossible. That's the message there. We should never give up. The moment has come now for us to interact, ask questions, and before I do that, I introduce myself as DJ HM Shimpundu Bulasho. But there is a message which Mr. Shamwana said regarding we need, as Zambians, we need to change our mindset. We need to pay. As a consultant myself, I'm a business consultant. Some of you know that I'm a lecturer at the university. And whenever I wrote a business plan for a colleague here, and they told me, no problem, we'll pay you. And they were in social care. So, it's not easy to actually draft a business plan. And I did that. And they were able to get a bank loan. And I've never heard from them. So I think for us to succeed in life as Zambian, we need to change the mindset. Okay, we are here. Consultants are here. We can help you. I'm a business analyst. We can help you if you want to set up a business. But you need to pay, because we have invested a lot. I had to sell my house, back home to pay for my PhD. It's not easy.
Hello. Sorry, I'm going to say this quietly. I have to say thank you very much for every single person that's come here. Every single year, every single month, every single week, we feel like, you know what, we can't do this no more, and we feel like quitting. We feel like Zambian Network can't work. We just feel like we've been doing this for 7 years now, and the support that we need here, we don't get. And we just feel like, how can we continue to do it over and over and over and over? And to come here and to hear people speak about their different journeys here reminds us why we're here. Reminds us why we do what we do. And hearing your stories here, I feel like so many people need to hear them, Like, I myself, I grew up here in the UK, I know more about the UK than I know about Zambia, And for the UK, there's just so many resources here in the UK. And I always just look at the Zambians that are here and who've got so many solutions and who've got so many things that they're doing in their own professions. And I'm like, you guys are diamonds, Imagine all that knowledge that you have here in the UK. If you took it to Zambia, you guys can become multi-billionaires here if you actually knew how to construct yourself in the right way. And I feel like some of the things that we lack in our community here is community, I feel like there's so many people who are doing so many amazing things, but unfortunately they're all individuals, meaning that it's only their close friends or their families that know about them. Nobody outside that circle group here actually knows what these people are doing and the amazing things that they're doing. And I feel like it's important for us to kind of speak out in a way about our profession. I know sometimes there's a bit of a stigma in our community that if you start talking about what you do, like, oh no, I own a pharmacist, no, I own a recruitment company, no, I own an app, it might look like you're trying to show off or trying to make yourself look like the big I am. But unfortunately, we have to be like that, because aren't you tired of saying the same things Look how the Nigerians are doing. Look how the Chinese are doing. Look how the Indians are doing. You know, do you want to continue that narrative for the next generation? I see kids in here, and I don't want, like, for me, myself, who grew up in the UK, I feel like I've heard these stories that my mom used to say until now being talked about. Oh, keep away from Zambians. Oh, Zambians are just troublemakers. Oh, Zambians are this and this and this and this. When there's so many people in this room here that explain a different narrative, you know, that narrative that we can actually come together as professionals, as business people, and collaborate. So just one thing that I just really, really want to say is thank you so much, because without seeing you guys talk and the experience that you have and the connection that you have here gives us a lot of motivation. And I feel like the Zambian community here has got, even though we are small compared to other communities, look at how many amazing people are doing amazing things. Just look at the examples and the stories that have been said in this room. And I'll be honest, some of them here, like, even though I know quite a lot of people here, but at the same time, when they're talking a lot in depth about what they do, I got blown out. I was like, oh wow, really? I didn't see you like that. You know what I mean? And it just makes you realize that how many people or resources or connections or knowledge that we are missing out because we do not know how to connect on a professional level. You know, we can just meet up and have fun and enjoy ourselves, but how can we actually become business partners? How can we become, you know, career drivers? You know what I mean? How can we become mentors? And I just feel like every single person that came here, thank you very much. I know obviously it took a lot of time to organize a lot of things here, but to be honest with you, hearing every single person talk here made us realize this is the reason why we did what we did. And thank you very much. And you know, I hope everyone gets home safe. We're gonna be cleaning up and moving up, so you can still stay here and talk if you want for a little bit, you know, as we're doing anything. So this place is gonna probably close in the next kind of 20-30 minutes as we're doing everything. So yeah. So thank you very much, guys. And without you, we wouldn't be what we are.
You know, before this young man goes away, may I just say thank you to him. Because at the end of the day, without you, Sean, and the people around, we cannot be here. They always say that knowledge is power. And this young man, I've been seeing this young man since he was young, you know. And thank you very much. Your mom is proud of you. Thank you. And continue the spirit of organizing such events, which are powerful, knowledgeable, lucrative as well. You are inspiring us, you know, by bringing it up. I didn't even expect to hear, you know, from Mr. Shamwana. Wonderful, you know, sort of a presentation. So thank you very much to the speakers as well. Thank you very much, Tatenda. Thank you very much, everyone. And remember, if you have had any alcohol, but there was no alcohol, don't drink and drive. That's the message some of us as DJs, we always say to people, if you've had some alcohol, please don't drink and drive. Thank you very much, and God bless you, all of you. Thank you.